Uh, so, so I'll start with each one of you. I've got some questions prepared. So some of you may not know what each one of you do, so I think it's important. I think when I met your dad last month in Ahmedabad, I was talking about Swapnil and Senora. Here, wow, that's really cool. A first generation entrepreneur building such amazing stuff was there in Ahmedabad. So you didn't know about you. I'm like, oh, is that? So then I was speaking about you, Swapnil, to him. So
you should have asked me. I know him very well.
Yeah, you would know him. Yeah. So I just wanted to sort of keep some context here. So Concord is the only company that in the world that manufactures an entire range of fermentation-based immunosuppressants, a process often called pharmas. What does it mean? Could
Yeah, pretty technical in nature, I guess. So let me simplify that. So basically, we manufacture APIs or medicines which are done through fermentation or through microbes. So living microbes, they have a tendency to make medicines, and we use those living microorganisms to kind of make medicines which are primarily used for transplants. So anybody who's undergoing transplant like kidney transplant, liver transplant, so they are given for their lifetime, they are given these medicines which are called immunosuppressants, because what it does is it suppresses the immunity of the body so that the organ can be accepted. So that's why it's called immunosuppressants. So I believe globally there are only 1 or 2 companies which are doing these kind of products, and Concord happens to be one of them. So we focused on very niche kind of APIs which are through fermentation.
So when I met Dr. Poonawalla, he always gives me a statistic that every 3 out of the 5 child or 2 out of 5 children in the world takes a serum vaccine. Is there enough statistics like that, like any in the procedure world, if you were to put something?
No, I mean, vaccines are kind of within the same umbrella.
No, I'm talking about, let's say you have to get suppressants done before a major surgery and so on, right? Only 2 companies in the world does that, was what he said?
Sorry, I didn't get you.
Your company, what you do, only 2 companies do that in the world,
yes.
right?
Yes.
So, in a spectrum of what's happening in the world, 1 out of how many, if you have to do a procedure like that, would use your product?
No, I mean, not, as I said that it's a difficult area to kind of work in, and you need a different set of expertise to kind of develop these kind of technologies, which over a period of time, people have worked in this industry, and we've worked with global pharmaceutical companies to kind of dwell on that knowledge. So I hope that kind of answers that. I'm not
Okay,
sure.
so large, let's say. Okay. So Swapnil, Senores IPO went from a 93x oversubscription at the time of IPO and almost 200% profit growth while expanding across about 49 countries. Such a young company, born in 2017, scaled globally from Gujarat. I know you've got some US experience, but then you're predominantly, you have strong roots here. Tell me a bit about how did that happen?
Yeah, so I mean, we've been working over from 2008, right? So I mean, whatever you see is happened in 2024, right? In terms of the oversubscription and so on and so forth. In last decade, our IPO was the most oversubscribed pharmaceutical IPO. So that's probably 1 in 10 years that happened. So
can you give a big round of applause? You all know that. That's a company from Gujarat, right? So
just to give you a perspective, except our anchor book, we wanted to raise about 300 crores and we got 32,000 crores worth of bids, right? So very, very fascinating moment, but also very responsible moment, because when you borrow money from people, you have to deliver. And that speaks for the second thing that you've said, that the profits have grown. Our growth journey has just started. I've been actively working in the United States since 2008. Probably I'm the only Indian who has traveled to 49 states. Only Alaska is the one state that I've not traveled to. Except that 49 states of United States, I have personally been to, multiple times on some of the states.
You've traveled to Canada?
Uh, I've seen the Canadian border and the Mexico border while I was traveling in different states, but never thought of jumping across. But yeah, traveled to both Mexico and Canada. But yeah, so for us, the journey has been from 2008. We started off as a distribution company, learned the business across, applied those distribution metrics and what we knew about the business. And like what Ankur said, but he comes from a very technical side of the industry, and I'm being a chemical engineer. As I did distribution business, I could kind of understand the scientific side of the products that were sold, right? So that both the commercial acumen as well as the scientific know-how kind of played a big role in shaping up where we are today, and as I said, it just started, right? Also just to give you one more perspective, I'm probably the only Indian who got 2 companies public in 2 years. So 2023, I got 1 company public, and 2024, I got another company public. So that's, it's as Anand said, we did not have means of resources, right? So we had to deploy all the resources. We had to grow our business, right? So, and we continue to do hard. We continue to do good work. We continue to work hard. Post IPO, I think I have worked 20, 30% more than what I worked before IPO. That kind of speaks for the responsibility that I carry on my shoulder for all 40,000 plus
and you
shareholders.
managed to convince Anand to join business as well.
Oh yeah, absolutely. And look, nobody can be a better partner than your spouse, honestly, when you are a first generation entrepreneur. And she's been a tremendous support all this while. Just imagine you have believe me, first generation entrepreneur, after 365 days, 300 days are disappointing. Trust me, I've lived through. So imagine you go back home and you have nobody to talk to about those 300 disappointed days. And when you have your wife part of your, the organization and leading certain activities, at least you have somebody to share those thoughts with. She could comprehend, she could understand you, what you're saying. That itself, psychologically, back of your mind, gives you good support, right? So, yeah.
I can totally relate to it. So let me come to you, Ronak. You're a different sort of situation. You're a conglomerate, but the one thing that is quite common between you and the others is the growth, right? The grew solar grew to 3 gigawatt in record time. Then your other business also is increasingly global as well. How do you manage all these things, man? It's so difficult to manage one.
In terms of, we are a joint family business, so we have 4 families. So I think the value system has been very strong. We are a part of a 50 years 50-cation. We have a little bit of chemical presence as well. And very recently we got into solar panel manufacturing through a renewable company called Group. So I think when it works well in one company, you don't have to actually rack your brain and try something else. So I think what we've realized is that we've documented the systems pretty well, kind of innovated them based on the industry we are in.
Did you use a consultant for it, or did you do internal?
We do have consultants as well
For designing systems?
For new business opportunities, for business analytics as well. But mostly, it's more of data analytics which we do internally, and before we take any decisions. One thing which I read somewhere, and which has worked really well for us as well, is it's very simple. If you want to grow, you should align your goals with the national goals. And if you are, so same thing we did with renewable. Like we've been seeing people, the Prime Minister talking about what the vision is for 2030, and Sir also recently mentioned about that. So I think, we just realized that if we align our goals to the country's goals, the growth becomes very simple and very easy.
Great. If I have to ask each one of you to describe the size of your business, it could be revenue, market cap, people, whatever, however you want to define it, right? Like a one-line thing about this is what we are. What would that be? Each one of you. Anyone, it doesn't have to be in any order. Anyone can take. You can start or.
No, I mean, if I have to look at it, that you know, for us, we have always focused in terms of um, looking into different technologies, you know, what are the unmet needs which are there and kind of working towards those unmet needs. In terms of our expansions, if you see, you know, for the next 10, 15 years, if I have to look at from that perspective, you know, Concord has seen in terms of growing into diversification of businesses from fermentation as a base in terms of how we can grow. So the growth has been primarily driven in terms of how we can expand our global footprint and grow there. So,
Are you working on weight loss drugs?
so that's something that, yeah, we're trying to build on. I know it's
You are, okay.
yeah, but I think in addition to that, you know, I think weight loss is definitely a medicine which a lot of people are talking about, but we are also now working a lot on cell and gene therapy. So that's, I think, we believe is also the future, because that, I believe, is going to change how cancer treatment happens. So we are working on very different technologies for the future, while ensuring that, you know, the fundamentals of what we've grown on, which is biotechnology, that also kind of grows in line with.
I mean, to some extent, we are working on not so similar path, but in a right direction, in a similar direction. I call it a lifestyle therapy, first time that has been existed, right? To what you're saying, weight loss. We've been working on the lifestyle therapy. Like, for example, if the weight loss happens, people will consult to cosmetologists, people will consult to plastic surgeons, people will consult to a lot of those areas where, you know, you want to look younger, you know. So first time, the way I look at the market, the lifestyle therapy has emerged, you know, it never happened before. So for a company like us, you know, we are looking to invest early on things that we feel is going to be the next generational therapies structurally. To what he said, biotechnology, biologics, you know, we are actively working on the biologic side of the business. Though small, but a significant step towards the advanced technology that we want to see our company into. So a lot of work is going on in that direction, and also we are expanding rapidly in India and outside India as well. I mean, you know, we have a plant in the US with the geopolitical situation that arises, you know, though there is no tariff on pharma, but the FDA views it very differently today, you know, where US manufactured products are given a preference on regulatory approval. So continue to expand on that side of the business. But yeah, so strong technology-driven expansion, I would say.
And just to answer a question, I think probably the revenue I can say is we are at 15,000 crores as a group. But I think the number which I am actually more proud of is, you know, the number of people who work with Chiripal Group. We have more than 22,000 people working for us, and, you know, it feels proud that, you know, directly we are impacting more than 20,000, you know, families. So I think that is the number which I am more proud of.
That's right. If he gave us the right answer. I was asking for the number that you're most proud of. Is
The numbers.
Oh, the numbers we are proud of.
Oh.
I mean, yeah, numbers are just numbers. I mean, you know, whether we you know, 3,000 people are working with Concord, but, you know, I think, and our numbers may be speaking very different in terms of what our growth rates have been or what our profitabilities have been. So, you know, as a company and as promoters, we truly never go by the numbers. I think we are more driven by what we do and how we do. And I think as long as you're dedicated to the kind of work that you're doing, I think numbers, beat any number, financial, non-financial numbers, they're just, you know, an outcome of the kind of work that you're building and doing on. So, so I think our focus as promoters are more towards what best we can do and how we can do that, and then all the things kind of then just fall in line.
Swapnil bhai.
Yes, so yeah, you know, it's true. lot of extent. But as I said, being young company, as you said, we've just been 10-year-old, so to speak. I think the remarkable number for us is nobody size of a company 10-year-old has a 50 plus A&Ds in the US, right? I think that's a remarkable number, I would suggest. And maybe another 5 years down the line, we probably double it up, right? So I think in the history of pharmaceuticals, nobody has been able to achieve that feat. So I think I'm extremely happy with what we have done.
Amazing. So I'll possibly ask last question because time's up. So the next decade, so I'll just give you a number. So when India added 1 trillion to its GDP, number of US dollar billionaires in India grew by 100% in our list. And just take it as number of billion-dollar companies. Don't look at it as billionaires, wealth, and all that stuff, right? And we have projected the GDP to double in the next 7 to 8 years in the current growth rate. So which is now adding another 4 trillion to India's GDP. So 1 trillion resulted in doubling of billionaires, number of US dollar millionaires increasing by 6 times in that addition, right? So with that perspective in mind, looking ahead in 2035, right, what is the biggest strategic bet in technology? Are you going to doubling down in your business? Is that where you see the opportunity is? Or what are the sort of biggest sort of trends that you see in India which would play out in terms of growth in each of your business and possibly for everyone in the room here?
Yeah, I mean, the pharma world is changing very rapidly, and you're talking about 2035, and just a while back we said that these Ozempics of the world have changed in the last 1 or 2 years. So I think 2035 is very far off. I think in the pharma industry things are changing very rapidly, and I spoke about the gene therapy, I spoke about the semaglutides. I think what we have to do is we have to kind of keep updating ourselves in terms of how the world is changing and kind of work towards that what we can do ahead of how others are looking at it. Because I think in today's world, probably many people are thinking the same thing at the same time in terms of what they can do. So it's a matter of how early can you gauge what the world is looking after and how early can you kind of implement that. If you are amongst the first runners to do something like that, that's where I think you will create value for yourself, for the company, and for your shareholders. So understanding the needs and then implementing it very fast is very important. And I think within industries, whether it is pharma or any other industries, everybody would have a lot of opportunities, but the ones which you can click at the right time are going to matter the most. And there are ample opportunities. You just have to see that, okay, what you're good at and how you can kind of do that at the right time.
Yeah.
I'll go back to 3 C's that Sir spoke about. I think that's
credential, credibility, and
cash
cash flow.
flows.
Yeah, I know it.
So pharmaceuticals is going through an AI moment today. Just to give you a perspective, $92 billion worth of biologics are going off patent by 2032, which is how the small molecules were between 25 to 30 billion in early 2000s, late 90s and early 2000s. So the opportunity size is 3 times, and that's in 4, 6, 7 years from today. Like Sir said, speed, right? Ankur also said the execution speed. So the speed towards that, where how much you can get to that 92 billion pie, I think that's going to shape how the pharma entrepreneur is going to be, or how many billionaires you will see in the next $1 trillion. That's one thing. The second thing is all the biologics segment. So earlier, all the biologics products were largely on oncology and immunology, which has kind of expanded to cardiovascular, diabetology, CNS kind of a drug. So the whole pie of biologics, which is I would call a pharma's AI moment, is being researched and being invented and being launched. So the whole dynamics, the earlier you can take it up, earlier you can invest, get the right people to kind of lead those activities, I think you will see the next wave of pharmaceutical billionaires from coming out of that trajectory.
Cool. Your
I think,
final word.
Yeah, I think sustainability, governance are 2 such things which, have been, people have been talking about ESG, and like Swapnil Bhai said, probably AI is also something which people have been talking about. We recently heard someone say in one of the podcasts that working is going to become optional.
Elon Musk.
Yeah. So, but I don't think that's going to happen. I feel that it's very important to actually, how you integrate AI in your business. Keep hold of onto the right talent, because I don't think AI will ever replace what humans can do. And I think yeah, the trend is actually getting into how to, and especially into manufacturing, when you see, people are actually talking about how we can use technology to kind of automate a lot of processes, to make them more seamless, to make them error free. A lot of Japanese principles are being adopted by a lot of traditional manufacturing facilities, which used to be just for automotive or automobile industries, are now being replicated in most of the traditional textiles.
How are you keeping up? Do you have an AI
So
team
we
now?
again, we do talk to a lot of consultants.
For implementing AI in your factories and
and
everything.
we also, like, because by God's grace, because we export, we keep visiting a lot of our customers, and we learn a lot when we travel. And I think and try to bring it back to and see how we can implement certain things to our business. And I think the other thing which I would want to say is, the way everybody is growing, and the country is growing, everybody's looking at India as one of the next superpowers of the world. I think it's very important to actually just take quicker decisions. Like I was just reading, like 5 years ago, 7 years ago, there was a goal for solar, and today I was reading an article that there is supposed to be an oversupply of solar panels. So it's very important to actually start moving backwards in the value chain, or probably sidewards, to see how you can complement what you've created and not become obsolete.
Beautiful. Thank you very much. I think it's fantastic talking to each one of you. I wish
Thank
we
you.
had more time, like a 2-hour podcast, because each of you are doing some serious stuff, right? I met your father a month back, and there was an Einstein's portrait and APJ Abdul Kalam's on the other side. So there's so much stuff going there. It's so lovely talking to each one of you. Can I have a big round of applause to each of the panelists, please? Thank you.
Thank you, Anas.
Thank you so much, gentlemen. Can we have a picture of this moment? Thank you so much. That was a great panel discussion.